NSAIDs for dog arthritis. User Guides Part 5. Aspirin. Aspirin, or acetylsalicylic acid, ASA, is an NSAID used often to relieve minor pains, reduce fever, and alleviate inflammation. Aspirin also has an antiplatelet effect, which prevents blood from clotting normally. Hence, low doses of aspirin are administered to people who are at risk of heart attacks and strokes. Currently, aspirin is the most widely used NSAID in the world by people, with 40,000 tons of it consumed each year. How it is used. Aspirin, specifically buffered aspirin, is sometimes used to treat pain and inflammation related to dog arthritis. However, aspirin is now rarely used for this purpose because of the many alternative medications that have fewer side effects in dogs. Nonetheless, if aspirin should be administered, it should be done under the direct supervision of a veterinarian. How it works. Aspirin acts by inhibiting COX enzymes. Buying aspirin. Aspirin is not approved by the FDA for veterinary medicine. Nonetheless, it is an accepted practice to use the drug in dogs. Aspirin is an over-the-counter drug, but this does not mean that dog owners can just purchase and medicate their dogs with it. As mentioned, direct supervision and advice from a veterinarian is needed, as there are certain situations where it could be unsafe to use in your dog. How it is prepared. Aspirin now comes in chewable roast beef and natural liver-flavored tablets. There is also a snap and chew treat variation of the drug, which is best used for large dogs. For aspirin that is beef or liver-flavored, it is important to store it in a secure place where other animals and children will not be able to reach the drug. This is to prevent overdosage. Dose. The active ingredient of aspirin used in dogs is buffered aspirin, which makes it gentler on your dog's gastrointestinal system. Nonetheless, the proper dosage should still be strictly observed. For small dogs, the 100 mg tablet is recommended with a dosage of 8 to 12 mg per pound of your dog's weight every 12 hours. For large dogs, the 325 mg tablet is appropriate at the same dose per pound. Overdosage and side effects. Aspirin works similarly to other NSAIDs, thus it carries the same risk of side effects. Keep note of any of the following side effects: vomiting, diarrhea, loss of appetite, darkening of stool color, change in behavior, or decrease or increase in the water intake. If these symptoms occur, discontinue using aspirin and notify your vet immediately. Drug interactions. The following drugs should be discussed with your vet if being used at the same time as aspirin. Corticosteroids, like cortisone. NSAIDs, such as Rimadyl. Methionine or high doses of vitamin C. Furosemide. Phenobarbital. Heparin or warfarin, any blood-thinning medication. Aminoglycoside or tetracycline antibiotics. How to use aspirin safely. Aspirin should never, or very cautiously, be given to the following dogs. Do not use in dogs that are allergic or oversensitive to aspirin. Do not use in dogs that have bleeding problems such as von Willebrand's disease. Do not use in dogs that have pre-existing gastrointestinal problems. Do not use in dogs that are pregnant or lactating. And do not use in dogs that have pre-existing kidney or liver disease.